Knowledge is power when it comes to heart disease, the #1 killer of men and women in the United States. But according to a Cleveland Clinic survey, Americans don't know as much as they should. In fact, 87% believe cardiac arrest is another term for heart attack. It's not. A heart attack is a blockage of blood flow to the heart muscle, which can lead to a cardiac arrest, a very different condition.
Cardiac arrest is when the heart is either beating wildly or not beating at all, and there's no blood flow.
CPR can be a lifesaver during cardiac arrest, but the survey shows only 1 in 6 people know the recommended technique.
There's been a change in recent years to chest compressions only without mouth-to-mouth breathing, and so most people didn't know, or many people didn't know, that in the adult, really all you have to do is do those chest compressions. The best rate is somewhere between 100 and 120 times a minute.
When it comes to a heart attack where a coronary artery becomes blocked, people often confuse the symptoms with those of a stroke.
Many people in our survey thought that having slurred speech or weakness is actually a symptom of a heart attack, when in fact that's a symptom of a stroke. People that have a heart attack, most people are going to have pain, usually in the center of the chest. It can go to the jaw or down the left or down both arms. It's often associated with nausea or shortness of breath.
The survey also finds that most people having a heart attack know to call 911 first, but only about 1/3 know to chew an aspirin as well.
A full-sized 325 milligrams of aspirin that can actually, in a few cases, can actually stop a heart attack.
Now, in addition to calling 911 and chewing aspirin, Dr. Nissen recommends taking nitroglycerin if you have it, but that would be mostly patients who already have a history of heart disease, primarily angina. One more important issue, many workplaces and public spaces have automated external defibrillators, or AEDs. An AED can help shock the heart back into a normal rhythm and save someone's life during cardiac arrest, so it's important to know where it's located. They're all over the place, actually, these days.
You bet. All right.
Important. Thank you.
You bet.